Thank you. Willie Rennie.
My condolences to those who have lost, and my appreciation to all those public servants who are doing an exceptional job just now, including those in care homes as well. It's incredibly stressful, and I think everyone here appreciates their work. My questions are designed to be helpful, to bring clarity, not criticism. I'm not convinced that there is clarity about which businesses and organisations should continue to operate and which should close. Some seem to believe that all non-essential businesses should close, but health guidance does not say that. With some exceptions, it says that if businesses can operate safely, they can continue whether they are essential or not. This whole situation is causing great anxiety amongst workers as well as employers. So can the First Minister perhaps bring some clarity to this very important issue?
First Minister.
Well, I have tried very hard to be clear on this, but in a way that accepts up front that we cannot give bespoke guidance that covers every single particular situation, although we are trying to offer advice wherever possible. But in summary, we have a group of businesses that have been told categorically they should be closed. So, for example, that is non-essential shops, pubs, restaurants, theatres. At the other end of the spectrum, we have businesses that are essential to the ongoing operation of the country, the businesses that keep the lights on and keep food flowing through the food supply chain. So they are essential businesses that should keep operating, although following health advice as they do. In the middle of that, that's where we have recognised there are different circumstances, and we've set out principles. So are the activities the businesses engaged in material to the well-being of the country? If so, can they allow staff to work at home? If not, can they ensure safe social distancing? And what I've said very clearly is if the answers to these questions on the part of a business is no, they should be closed. And I make no apology for that, because I don't underestimate the impact of all of this on the economy. And trust me, I don't underestimate the challenge and the task for all of us after this of rebuilding the economy. But as I said yesterday, and deliberately starkly, we can rebuild the economy, we can repair the economy, but we can't bring people who died back to life. And that is why the absolute priority, and if any business is in any doubt, they should err on the side of protecting the health of their workers and protecting life. And that's my very clear advice to them.
Willie Rennie.
That does help, and it does bring some clarity. I've spoken to many businesses, employers and workers, and it's possible to work through those issues, but it does take a bit of time, so clarity is important. Should those who share homes with those who are on the shielding list, should they be going to work or should they remain at home? What is the advice to employers on that? And some people in self-isolation or shielding are beginning to run out of cash and don't have access to online shopping. They can get support from a mutual aid group, but has the government considered ways of making sure that people can pay for goods if they don't have cash and they don't have access to the online shopping? And there's also concerns about how parents and carers of disabled children being supported, how can they maintain that support when they're at home, perhaps when they're shielding or self-isolating? They're under incredible stress just now and need that kind of support. So what can the First Minister advise?
First Minister.
Well, can I say firstly, I'm happy to make more detail available in these questions because they're all important questions, but in general and as quickly as I can, in terms of people sharing a household with somebody in the shielded group, the advice to the shielded group, and this is why it's such hard advice, is effectively to isolate themselves within their own households as far as possible. Sleeping in a separate room, using separate utensils, separate towels and such like. And so it's about them isolating themselves. That said, if somebody in the household and if the nature and circumstances of the household make that more difficult, then I would say to employers of a relative or somebody in the same household as a shielded person to take that into account if their business is still running. And I think it's really important that they do so. On the issues around access to cash, we have given local authorities money to increase the welfare fund as a source of emergency support for people. We're also providing additional resources to local authorities to deal with food poverty and to give more resources to organisations working on the front line of these issues. Again, that detail is all available. We can make it available again because it's important people are aware of it. And of course, we encourage people, although For understandable reasons, the waiting times for universal credit are long at the moment. We're encouraging people to apply for that kind of support as well. So we continue to work with councils and with frontline organisations to make sure that as far as feasibly possible, we are getting as much support direct to people as we possibly can. I've already mentioned the issue that is not exclusively being experienced by older people, but I think particularly of difficulties getting home deliveries of food from supermarkets, and that's one that we're very much focused to see whether we can do anything in addition to what we're doing for shielded people to try to address that.